research raising questions about the best way to treat the early stages of breast cancer. What every woman needs to know about a disease that's claimed far too many lives. Well, a new study raising questions about whether certain kinds of breast cancer should even be treated at all. Very early stage cancer, known as stage 0, is often treated the same way a later stage tumor is as well, both of those being treated with surgery. But researchers found that treatment may not make any difference in the long run. Dr. Erica Hamilton is the Associate Director of the Breast Cancer Program at Sarah Cannon Research Institute. It's nice to have you back in the program, Dr. Hamilton. It's an easy reaction we could all understand. If you hear you have first stage cancer on your skin or in your body, you'd like to get it out as fast as possible. What is this study really telling us about surgery?
Thanks so much for having me, Jenna. I think what you said is exactly right. This study was about DCIS. That's ductal carcinoma in situ. And what this condition is it's breast cancer cells that have formed within the milk duct of the breast, but haven't yet gotten smart enough to break outside the duct. And I think the controversy about this story is a lot of people are using this study to say that DCIS shouldn't be treated aggressively with surgery, that surgery may be overkill for some patients. And they're basing this on the fact that the women who had surgery then went on to have an identical risk to later die from breast cancer as the general population. But I don't think this study really answered the question for us about whether DCIS needs to be treated with surgery. And the reason I say that is that everybody in this study did receive surgery. So to say that they would have done equally as well had they not had the surgery, I don't think we have the evidence for that.
So you want some more information. We're getting the news that technology, whether it's for breast cancer or colon cancer, the pictures that we're getting of these early stages of cancer are really vivid. I guess the question for medical professionals and for us as patients is whether or not we know what to do with the pictures, if whether or not we can actually have a good diagnosis yet with some of these amazing images that are showing us some of the early stages of what could be cancer.
Right, and you've touched on the exact issue. As our technology, as our imaging with mammograms, our screening tests for breast cancer gets better and better, it's a double-edged sword, right? On one hand, we find these cancer cells that haven't gotten smart enough to get outside of the ducts yet, which is a great thing. We can catch them early. But on the other hand, we may be over-treating some women. And the problem is we don't know yet how to differentiate these DCISs that are bad players that are going to go on to, form an invasive ductal cancer that could possibly spread somewhere, and which ones that will remain in the duct and don't necessarily receive treatment.
So what do you think are the right questions that patients should be asking if they do get a read, whether, again, going back to whether it's breast cancer or other cancer, that this could be the early stages of cancer? What are some of the questions you should be asking your doctor?
Right. I think that's a good point. I think it's an individual conversation between that patient and her doctor, and there's a variety of factors that play in. My mother was actually many years ago diagnosed with DCIS, and she did choose to have a mastectomy, and it was the right decision for her. At the time, she was young. She was only 40. She had a young child at home, and for her, knowing that she was living with these abnormal cells in her breast every day was much more worrisome to her than the thought of maybe having a surgery she didn't need. But for somebody else, that may not be the right decision. For somebody else, the thought of having an unnecessary surgery might be a lot more frightening.
Sure, absolutely.
And I think particularly, people that are older, we know that DCIS takes sometimes years to develop into cancers. And so it's a delicate balance that we really just don't have all the answers to yet.
Let me just ask you a quick final question, because I think in general this has come up with breast cancer about surgery. You are amputating a body part, and some women have felt in the past that this has been kind of an easy solution because this isn't a necessary body part to have, that perhaps doctors have taken that path simply because it's a breast and it's not an arm or a leg, but if it was something else, it would be different. Do you think there's a little bias because it is breast cancer and, the thought is, well, you can live without it?
Yeah, I think, all of our studies show that lumpectomy, just removing a small part of the breast that has the cancer in it, combined with radiation, is equally effective for breast cancer than mastectomy. A lot of times, I think just the fear of having a breast cancer diagnosis is driving the rates of mastectomy. And there are certainly instances when somebody's breast cancer is large enough or the DCIS encompasses a large enough portion of the breast that a lumpectomy just doesn't make sense. But a lot of times we can do breast conservation for these women, and they don't need to lose their breast.
It's nice to talk to you, Dr. Hamilton. A great deal of knowledge on the topic, and we look forward to having you back. Thank you.
Thank you.